Hi, my name is Dr. Aditee Satpute. I'm a board certified family medicine physician with Perimeter North Medical Associates in Suwannee. As a primary care physician, I've partnered with the cancer support community of Atlanta to talk about your healthy numbers as we start the new year. When you go to a primary care doctor's office, usually at your annual visit, preventative care entails screening for diseases like hypertension, diabetes, high cholesterol, obesity, and depression, along with screening for certain cancers. You'll also be able to discuss vaccines that are needed at your age and discuss healthy lifestyle, diet, exercise, and everything with your primary care provider at that time. So let's talk a little bit about some of these numbers that you should be looking for. Let's start with blood pressure. The normal blood pressure for adults is 120 over 80. 120, the top number is when your heart pumps the blood out of the heart to the body, and the bottom number is the pressure when the heart is receiving the blood from the body. When you have hypertension, means the blood pressure is above 130 over 90. It can, when you have high blood pressure, it can cause strain on your heart, lungs, kidneys, and it can also affect the blood supply to the brain. And if not treated, it can lead to heart attack, stroke, kidney failure. And it can also cause rupture or clotting in the big vessels in your stomach. So it's important to get those numbers checked and discuss with your primary care provider. Now, let's talk about cholesterol. There are three important cholesterol numbers that we usually look at. One of them is called triglycerides. The healthy number for triglycerides is anything below 150 milligram per deciliter. LDL, or low density lipoprotein, is known as the bad cholesterol. Ideally, the level should be less than 100. And HDL is, it's known as the good cholesterol. Normally, the level for women is more than 50, and for men is more than 40. So you want to have a higher number on your HDL and a lower number on your LDL. And depending on the numbers, your doctor will decide what the next steps would be. When you consider abnormal cholesterol, you also have to consider your age, your gender, other diseases that you have, and then decide on medicines accordingly. Let's talk a little bit about your blood sugar. When we screen for diabetes, we look at two different parameters. We look at your blood sugar, and we also look at a number called hemoglobin A1C. Hemoglobin A1C provides kind of an average of your blood sugar for the over 3 month period prior to testing. So your normal blood sugar is less than 100 when you're fasting, or a hemoglobin A1C, or HbA1c as we call it, of less than 5.7%. If your fasting blood sugar is more than 100, or your hemoglobin A1C is more than 5.7, you might be pre-diabetic, or if your HbA1c is more than 7, you might have diabetes. Uh, just like hypertension, diabetes can affect all your organs in the body and is also considered a major risk factor for heart attack. It can also affect your circulation, your kidneys, your eyesight, your sensation in your feet. It also causes your wounds to heal slowly. So it's important to start checking for diabetes early on, and also to prevent complications and all the other organ damage. The other main important thing that we talk about when your primary care office visit is your weight. When you consider, we don't just consider your weight, you also have to consider your weight compared to your height. So we check this number called the BMI, or body mass index, which is the ratio of your weight and your height. Your normal BMI is 18.5 to 24.9. Anything above that is overweight and obese. Obesity, we consider somebody obese when their BMI is more than 30. Now, obesity is a very big cause for high blood pressure, diabetes, arthritis, especially in women, menstrual irregularities. And diabetes and obesity are also linked to some cancers like endometrial cancer, kidney cancer, stomach cancer, colon cancer, breast cancer. So these are some of these the common things that we check for in a when you come for a preventative visit. Now, how do you monitor at home? You can check your weight at home. You can check your blood pressure at home. If you want to check it first thing in the morning when you're resting to get an accurate reading, and check it at the same time every day. You don't want to just rely on one number. You want to have a series of numbers to be sure if there is anything, if there is really a problem, and then you can just discuss that with your primary care doctor about it. If you are interested in learning more about the free oncology support programs available, visit Cancer Support Community Atlanta at cscatlanta.org. Thank you.